The Senate Republican health care bill is a wolf in sheep's clothing. Only this wolf has even sharper teeth than the House bill.
Senate Minority Leader Chuck Schumer with his reaction to the GOP health plan from the Senate. He says it's, quote, heartless, and you heard, has sharp teeth. Well, let's bring in a sharp pair of eyes. Dr. Stephen Klasko has been looking at the Senate plan all day long. He's been front and center in the fight over Obamacare and the fight to improve it, really. Dr. Klasko, first, have you read all 142, 145 pages?
I have. It's a real blast.
What do you love and what do you hate about this Senate plan?
Well, what I love is that it is, as President Trump would say, less mean. It does not have sharper teeth. I disagree with Senator Schumer. It's got better wording on pre-existing conditions. It has the tax credits be more logical based on income and age as opposed to just age. So I think that some of the kind of patients they were parading out as being harmed, it is more generous that way. What I hate is still defining essential health benefits. It is not an essential health benefit for a 65-year-old to have maternity care. It is an essential health benefit for a 26-year-old. And a 26-year-old can still get a skinny plan based on some states, and then if she gets pregnant, she ends up in the emergency room. The insurer doesn't have to pay it. The government counts her as insured, and she'll show up to my emergency room, and literally it's a hidden tax on our business because we're going to have to take care of her.
Okay.
It also doesn't deal with any of the cost issues.
Okay, well, let me jump in on this. Does it increase premiums on older Americans? That seems to be a pretty big question here.
It will on certain older Americans. It will increase the gap between what it costs for insurance and the tax credits. One of the problems, and since there's no regulation really on what insurers charge, and the tax credits are pretty well defined, that when you get to those lower income folks, there will still be some folks, and I'm quite sure the CBO will grade that there will still be several million folks that will not be able to afford insurance.
Okay. Now let me ask if there's a question at all that this thing fails. I mean, you now have four senators. Senator Ted Cruz of Texas, Mike Lee of Utah, Ron Johnson of Wisconsin. We also have Rand Paul of Kentucky. They say they're out. They do not like this plan, and it becomes a real issue because the Senate's really trying hard to do this reconciliation where they won't need votes from Senate Democrats, and they need 50. This does not get them 50 with these four against it.
Yeah, I'm not sure what other compromises you can make. Let's make this really clear. This is not repeal and replace. This is repeal, get rid of some Democrat taxes, and get rid of unlimited federal funding for Medicaid, and then hope that health care costs will decrease.
Well, that's called compromise to me, right? And is compromise such a bad thing?
Well, no, and honestly, if I was in the Senate, I would look at the 142 pages I read and probably have a few amendments that I'd want to make and vote for it, given where we're at today. But I think you mentioned four folks that are looking at things and don't want to have their name attached to this bill.
Well, because their constituents, they believe, don't like the spending. Does it add to the deficit? That's another issue. How do we pay for this?
Yeah, well, my guess is it won't. I think the big issue, and I've talked to some of the folks involved that were drafting this, the big issue is Medicaid. And the federal government wants to get out of unlimited funding of Medicaid. And the House bill had it happen right away. The Republican governors that Medicaid expanded would have had to pay more. This is a little bit like Brexit. It's like Medicaid exit. Do we do a soft Brexit or a hard Brexit? But either way, the federal government is trying to put more of the onus of Medicaid expanding by $30 to $50 billion on the states.
On the states to make that decision. And that's a little bit controversial, too. But in the end, you as a doctor, think of your patients. Are you okay with this? Do you feel most of your patients would be covered and would get the quality care they need?
I think that with some revisions that this bill would make some sense if the tax credits were right and if they handled the essential health benefits issue. I would probably not vote for this bill as it is today because of that essential health benefits issue.
Good to have your perspective, sir. Thank you so much.
Great to be on with you, Liz. Thanks a lot.
Dr. Stephen Klasko, Thomas Jefferson University Health President and CEO.